Welcome po sa ating programang Dayun Kita DOH. Maraming salamat po sa lahat ng mga tumututok at sumusubaybay sa ating programa tuwing Huwebes alas 9 hanggang alas 10 ng umaga. At kasama nating nagpapalawak ng kaalaman ukol sa Department of Health Eastern Visayas Center for Health Development sa ating dalawang DOH retained hospitals at ating treatment and rehabilitation center sa Dulag, Leyte. Tayo po ay napapanood sa PRTV 12 at napapakinggan sa 100.7 Favorite Music Radio. Napapanood din tayo sa ating mga official Facebook pages ng ating ahensya ng Department of Health Eastern Visayas, kasama na ang mga official social media pages ng ating mga retained hospitals and treatment and rehabilitation centers. So sa mga hindi po nakapanood ng ating mga previous episodes, kindly visit po ng ating mga social media pages. So sa nagdaang mga episodes, we have introduced the four facilities, yung ating ahensya, ang Eastern Visayas Center for Health Development, ang Eastern Visayas Medical Center, ang Governor Benjamin T. Romualdez General Hospital and Schistosomiasis Center, at yung last week na episode natin, hinighlight natin ang DOH Treatment and Rehabilitation Center sa Dulag. Ngayon naman, sisimulan na natin ang pag-delve into some mga basic services. Pupuntahan na natin in details ang ating mga ahensya at i-discuss natin ang mga basic services nitong DOH EVCHD at ng ating mga facilities. Ang pangunahing tungkulin ng Department of Health Eastern Visayas Center for Health Development ay ang pagbibigay direksyon sa health sector at magsilbing technical authority pagdating sa kalusugan dito sa Eastern Visayas. Dahil dito, kinakailangang masigurado ng Department of Health na ang mga serbisyong pangkalusugan na natatanggap ng ating mamamayan ninyo ay may kalidad at naaayon sa mga pamantayan na ipinatutupad ng Department of Health. Kaya naman, exciting ang ating topic this morning. Makikilala natin ang Regulations, Licensing and Enforcement Division ng DOH EVCHD. And of course, makakasama natin this morning, walang iba kundi ang namumuno sa division ito dito sa DOH EVCHD. Let us all welcome ang Officer in Charge, Chief ng DOH Eastern Visayas Regulations, Licensing and Enforcement Division. Walang iba kundi si Dr. Noel Arteche. Hi Doc, good morning.
Hi, good morning Jeline. Good morning everyone, and we're happy to be here to share to you things that you would want to know about this service that the Department of Health is giving to our constituents. So magandang umaga sa inyong lahat po.
So unang-una sa lahat, Doc, we would like to thank you po kasi we know how busy ARLAD is, pero you have spared us 1 hour of your time. Maraming salamat po. And of course, sigurado ako marami din sa ating mga manunood at nakikinig ang gustong malaman ang tungkol sa ARLAD. So, thank you very much po. We were really looking forward for this episode kasi malaki yung ginagampan ng tungkulin or role ng ARLAD sa Department of Health. So, simulan na natin, Doc. Unang katanungan agad. Ready na po ba tayo, Doc?
Okay.
Alright, sige po. So, unang-una, Doc Noel, ano po ba ang Regulations, Licensing and Enforcement Division o ARLAD dito sa DOH?
Okay, so ang Regulations, Licensing and Enforcement Division of the Department of Health Eastern Visayas, tayo po ay yung arm of the Department of Health to license, regulate, enforce. Ibig sabihin ng regulations is to maintain the standard for our health facilities na ating nililisensyahan, and to ensure that these facilities are compliant to the standards that are set by the Department of Health. And these standards are just aimed to ensure the safety, the safety and quality of health services that are being given by our regulated or licensed health facilities.
So yun po yung ating layunin ng ating division. So yun yung main function and mission natin, to regulate and ensure na nasa kalidad po yung mga serbisyong binibigay ng ating mga health facilities. Tama po ba, Doc?
Yes, ito po, Jeline, ay ang ating Department of Health, through our HFSRB, met with did yung ating with our partners, no, a consultation and a meeting to come up with a minimum standard for safety and quality service, no, at ito ang ating ginawa itong assessment tool, and that is what we are using as our standard in licensing, and we are also ensuring that these are maintained throughout the year by our health facilities.
Alright, so dapat at least yung minimum ma-meet nila.
Yes, minimum
at
standard.
masustain for the whole year.
Yes.
Okay. So, ano-ano naman yung mga facilities po na ating nire-regulate ng ating division?
Okay, so we begin with the hospitals, no? We have level 1, 2, and 3 hospitals. And then we also have our primary facilities, primary care facilities, which includes our infirmaries, our birthing homes, our custodial care, no? We also have our clinical labs, and even our drug testing labs, no? Even our water analysis testing laboratories also, no? Basically, even our no, yung na-mention natin kanina, yung ating drug rehabilitation and treatment center, no? These are all under the regulations of the Department of Health.
So sa ngayon po, na-mention niyo po kanina yung mga hospitals. Siguro it's time for our public to know ano po yung mga levels ng hospital at ano yung pagkakaiba po nito.
So in general lang, no? In general lang, Jeline, no? So the hospitals are level 1, 2, and 3, no? The major requirement for hospitals are they should have they should be serving yung 4 major branches of medicine, which is internal medicine, pediatrics, obstetrics and gynecology, and our surgery. Okay, so in the level 1 hospitals, no, these are not yet departmentalized, pero they can deliver these services, no. General practitioners are the doctors mainly in these hospitals, no, but they cater to all these services na na-mention ko na kanina. For level 1 hospitals, they are required to have an operating room and a delivery room, no, x-rays and pharmacies. So that's level 1. For level 2, this is the referral center supposedly of level 1 hospital. So sila ay departmentalized na ngayon. There is a specific surgery department, internal medicine department, obstetrics and gynecology, and pediatric department. They are also required to have their sets of consultants, and those who are on duty are easily accessible, no? And there are specialists that are easily accessible in level 2 hospitals. While the level 3 hospital is higher than level 2 in the sense that the qualification for a level 3 hospital is this should have at least 2 of their major branches of medicine, which is accredited by their societies, no? Yung societies, we mean the specialty societies of our doctors, no? Yung surgery, either surgery, medicine, pediatrics, and OB/GYN. So as a minimum requirement for a hospital, level 2 hospital to become a level 3, they should be accredited in at least 2 of these major branches ng medicine, specialties of medicine.
So, sa ngayon po, Doc, ilan po yung ating mga level 1 hospitals, level 2, and meron po ba tayong level 3 hospitals dito sa Eastern Visayas?
So, in our records, we have 41 level 1 hospitals, 40 level 1 hospitals, and then we have 7 level 2 general hospitals, and then we have 2 level 3 or the apex hospitals natin dito sa ating region.
Yun yung Eastern Visayas Medical Center.
If I can mention, no, that 2 level 3 hospitals are our own government DOH retained hospital, the EVMC or the Eastern Visayas Medical Center, and the Divine Word Hospital.
Isang private.
Private. So
Alright.
one government and one private. Yeah.
Okay. So, nabanggit niyo po, aside from the hospitals, you are also regulating mga other health facilities.
Yeah.
So, pwede niyo po bang ma-share again? Na-mention niyo po kanina, infirmaries.
Yeah.
Mga ilan na po yung ating mga infirmaries all over the region?
So, we have 41 infirmaries, no? Other facilities nating nire-regulate are clinical labs, drug testing labs, no? Our birthing homes, no? And our water testing, yung ating water testing lab. So, and yung ating isang special hospital natin, yung ating drug treatment rehabilitation center in Dulag. Okay.
So, Doc, matanong ko lang, when it comes to birthing homes, like, I could only imagine, lahat yata ng mga munisipyo sa buong rehiyon, mayroon na tayong mga birthing homes. Sa iba nga, dalawa or tatlo ina munisipyo. So, more than 100 birthing homes ang ating nire-regulate all over the region. Tama po ba?
Yes po.
Okay, sige. So, ang dami naman.
Now that you've mentioned that, can I mention the people, no? The staff of ARLED. So, ARLED is composed at present of 15 regular employees and 7 support staff, which are our contract of service. And to do these things na sinasabi natin dyan, we have to do 2 teams, no? We have organized 2 teams, and these 2 teams go to the different provinces every week, and they do specifically that, monitor our licensed health facilities, no? So lahat yan na na-mention ko, we have a monitoring plan to go around the region to have at least, we are mandated to do at least one monitoring visit to these licensed facilities through the year, in 1 year time.
So, ini-ensure talaga natin na at least ma-visit natin ang lahat ng ating mga health facilities all over the region.
Yes.
At least once a year.
And I'm happy to inform everyone that last year, no, this was based on the assessment of DBM, no, yung ating ginawa nilang assessment of our accomplishment. And we have met our target, and we have exceeded our target in monitoring and also in the issuance of our licenses and permits. So with that, I am thankful to the team na meron tayo dito sa ARLED, and also our execom of the Department of Health and Region 8, no, na pinangungunahan ni Doc Exo sa Valberino. Apart, if hindi sila fully supportive, then mahihirapan tayo dyan. But with their full support that we have experienced through the years, we have achieved the target and even exceeded the target. So, ganun po yung ating accomplishment last year. And I would like to thank, of course, the staff of ARLED for working as a team para ma-achieve yun.
Oo naman. Kasi na-mention you, Doc, with all that number of health facilities all over the region and with that number of manpower sa ARLED, nakakaya natin to monitor. So, and speaking of monitor, Doc, alam ko marami yung tungkulin. Ano yung mga major functions po or ano yung mga tungkulin ng ating ARLED talaga sa mga health facilities dito?
Okay. So, yung na-mention natin kanina, no, one is we do the inspection of initial, and when we say initial, new health facilities, new hospital, new birthing home, new clinical lab, pagbago, the term we use is inspection. They apply for an initial application, and then we do inspection, no? So, we have an assessment tool to determine if they are now of standard. We also give them a copy of this assessment tool for them to assess before they apply, no? Kasi they have to check kung na-meet na ba nila yung standard nila o natin sa Department of Health. And then when they have met that standard, they submit the self-assessment tool together with their application and payment kung meron tayong fees. And then we do go to the hospital. So yun yung isa, no, inspection. Yung pangalawa is monitoring for the health facilities. Those who are already licensed, we do visit them every year to see and just to ensure that they are meeting or keeping the standard for licensing, no, to ensure then sa adequacy of staff, adequacy of equipment, no, para sa ating mga constituents. And third, we also do yung review and issuance of permit to construct. Ito naman ay may kinalaman sa structure, no? Before a facility is built, nagsasubmit sila sa atin ng floor plans, no, and their like the legal documents establishing their facilities, like if it's an LGU owned or government owned, yung kanilang mga resolution, board resolution, Republic Act, o if it's a national hospital, no, and if it's naman owned by private individuals or corporations, siguro a SEC or a DTI support, no? Just to establish the name and the personality of this who are applying. And of course, this is supported by their floor plans. This is being reviewed by our engineers, and eventually a permit to construct is given to them before if they are compliant, no? And the permit to construct, siya ang magiging basis. The next step for that is their application na for application for LTO. After the permit to construct, they construct. And after construction, they apply for license. So, basically, yun yung ating ginagawa.
Okay. So, Doc, napakalawak naman ng work ninyo. So, pero na-mention niyo po na you have engineers. May I know lang po yung composition ng ating manpower sa Arlen?
So, the team is composed of a doctor. No, we have a doctor, a nurse, an engineer, a pharmacist, no, a medtech. So, those are the basic na part of our teams, no? And they perform the different, hindi ibig sabihin na yung medtech sa laboratory lang. Our medtechs can do also assessment for the birthing homes, no? And our nurses could help in the assessment of clinical labs, because we are guided by an assessment tool, and we are naman trained to that, no? To use that. So they can help each other and work smoothly as a team doon.
So, sinabi niyo po, guided po tayo ng assessment tool.
Yes.
So, this assessment tool po is provided ng the National Office?
This was formulated, no, with the help of the stakeholders natin, yung sinasabi nating specialty societies, the Hospital Association, the Midwives Association, the Birthing Home Association. Specifically kung ano yung kanila, no?
Yung standard na.
Laboratory, clinical laboratories organization, sila, no, they help in the formulation ng kanilang assessment tool with the Department of Health experts also.
So, napalawak na po ng ating napag-usapan, Doc. Pero gusto ko lang i-summarize siguro na ang ARLED, kayo yung division na in charge in ensuring na yung mga services na natatanggap ng ating publiko is at par or yung nasa standard talaga by conducting monitoring, inspections, and issuing licenses. Tama po ba, Doc?
And during monitoring, when we see deficits, they are required to comply, no, given prescribed time, no, and this is the way to ensure na mag-comply sila, no? And so far naman our facilities naman are doing what they can to comply with these requirements.
Pero I'm sure, Doc, other than monitoring and all, you also provide technical assistance talaga.
Actually, during monitoring, we continue to do technical assistance. Because when we see some deficiencies, we also do technical advice how to comply with these things.
So, tinutulungan talaga natin yung mga health facilities all over the region.
That's why we also, another part is part of this, I'd just like to mention, as regulations, we also give sanctions to erring, yung may mga violations, no? Meron din silang, they're given the time naman to comply, na kung makomply naman nila, no problem doon. They're given 30 days to comply for deficiencies. Pero yung hindi talaga nila mako-comply, merong karampatan naman na mga sanctions, which is actually it's not the purpose of our visit, but to help them first. But if hindi talaga ma-comply, then there are policies that govern also yung ating mga non-compliance of standards, no? Yun isang point dun sa monitoring. But we are really emphasizing when we visit health facilities, we work with our owners and the staff because we know they are our partners in the delivery of health services. Our priority really is to assist them and do what assistance we can give them through advice, technical, no? To make it accessible, easier for them to comply, no?
So, yan, napakalawak na po ng ating napag-usapan. Mas nakilala na natin ang RLED o ang Regulations, Licensing and Enforcement Division ng DOH EDCHD. Sa pagbabalik po natin, we will discuss naman kung ano ang tungkulin o role ng RLED sa pagpapatupad ng universal healthcare dito sa Eastern Visayas.
Papa Vaccine! Bakunada! Sige kang ligtas! Nagbabantang kalaban na dating napuksa, muling lumalaganap at lubhang nakakahawa. Kaya dapat sabayan ng paghahandang maging ligtas. Nakakabahalang maraming batang tinamaan ng polio, rubella at tigdas. Siguraduhin may paranggalang na malakas. Yeah! Nakahanda na ang bakuna na mabisang pumuksa. Kaya huwag na mangamba at mabalisa kaysa maparalisa sa polio. Ang mga anak nyo, agapan ng magpapatak habang maaga pa. Let's go! Walang lunas sa tigdas at rubella. Tanging pang-iwas ay magpapakuna. Kaya maging handa na. Ikaw, ako, tayo, protektado. Chikiting ligtas, dagdag na bakuna laban sa tigdas, rubella at polio. Sa ating mga anak, tungkulin natin lahat. Magpabakuna, maging ligtas para sa healthy Pilipinas. Chikiting ligtas, para sa healthy Pilipinas. Chikiting ligtas, ikaw, ako, tayo, protektado. Chikiting ligtas, dagdag na bakuna laban sa tigdas, rubella at polio. Sa ating mga anak, tungkulin natin lahat. Magpabakuna, maging ligtas para sa healthy Pilipinas. Chikiting ligtas, para sa healthy Pilipinas. Chikiting ligtas, magpabakuna na para sa healthy Pilipinas. Chikiting ligtas, magpabakuna na para sa healthy Pilipinas.
Okay, welcome back po sa ating programang Dayon Kita DOH. Kasama pa rin natin ang OIC Chief ng RLED Division dito sa DOH Eastern Visayas. Kaya kanina na pag-usapan natin kung ano yung RLED at ang mga tungkulin nito. Ngayon naman tatalakayin natin kung ano ang tungkulin ng RLED, yung division na ito sa pagpapatupad ng universal healthcare dito sa Region 8. So, unahin na natin ang unang katanungan, Doc. Ano ba ang tinatawag na primary care provider network? Kasi sa universal healthcare, ito yung paulit-ulit na binabanggit at mayroon talagang emphasis on shift po. Kailangang i-strengthen yung primary care. So, ano ba yung primary care provider network?
Okay, importante, no? Very important ang primary care network in the sense that ito ang nagsisilbing foundation, no, of the universal healthcare. The primary care network is actually consists of yung ating mga rural health units, no, our district health centers, and our meron din yung private,
Mga
no?
private facilities.
Eventually there will be
Yes, po.
private inclusions, no? And itong network na ito, that is why they are called primary care, because they are the ones that are nearest to the people. So we know the rural health units or our municipal health offices, sila talaga ang nasa mga nayon, no, sa mga towns. Our city health offices are composed of different
District health centers.
district health centers. So dito sa ating region, we have this in the cities, no, like Ormoc and Tacloban that has long been cities, no, and our new cities like our Borongan, Baybay, Catbalogan, Maasin, yung Calbayog and Tacloban and Ormoc, medyo matagal-tagal na sila. So for the cities, yun yung kanilang district health centers. For the municipalities, yung ating municipal health offices or the RHUs. So the network is the one, no, because they will be the one who will see first, no, our patients who are needing medical care, and so it is important to strengthen the primary healthcare network kasi sila ang nagko-compose ng first touch or the first facilities that see our patients.
So, ano naman po ang layunin or bakit kailangan i-establish po ang mga primary care provider network?
Ever since 70s, naging 80s, no? This was really dati Ministry of Health pa, tapos naging Department of Health na. This was really the vision, no? To strengthen the primary care network, no? To decongest our hospitals. Because yung hospitals natin noon, whether level 1, level 2, level 3, na hospitals, ay natatambakan ng mga pasyente na pwede naman palang ma-serve dito as outpatient, no? And the one who delivers the outpatient services in the network sana of health facilities are the primary care facilities. So now, with the UHC, ini-strengthen ngayon ito so that one, ma-decongest talaga yung hospitals, no? To decongest the hospitals would mean the doctors who are specialized in the hospital can serve the patient na kailangan talagang ma-admit, and they will not be tied up doon sa outpatient department, no? This will also save the hospital beds for those who really need admission. Kasi minsan yung iba, pag pumupunta na lang doon dahil yung iba din is malayo ang pinanggalingan, so maaano na lang for consideration na minsan i-admit mo na lang for na they could have been taken care of doon pa lang sa level na malapit sa kanila. So, and yung number 3 nga natin is it will make the services stronger, nearer to the population.
Siguro na actually existing naman to yung mga facilities natin. And all we have to do right now is to strengthen the network. Kasi hindi ganun ka informed din yung public na yung ating we have this primary services available sa kanilang mga levels, sa kanilang RHUs mismo. So, sa papaanong paraan mas mapapalapit ng gobyerno ang mga serbisyong pangkalusugan sa ating kapwa Pilipino?
Okay, so again, hindi lang ito now, but we are again at this point we are strengthening, no, the foundations that has been laid, no, by the Department of Health, Ministry of Health pa nung una, no, of course with the support of the different administrations na dumaan na, no, and ngayon napunta na tayo dito. We are helping, no, particularly tayo sa DOH, we are now helping the LGUs, the local government units where these primary care facilities are located, and this is continuing, and na-strengthen lang ito din also with the universal healthcare. So marami ito, no, we are helping them through our facilities enhancement na nagbibigay ng facilities and also equipment. We are also doing continuing yung programs natin, continuous training to support, no, the improvement, no, and skills of our healthcare workers, and through their trainings, policies development, so that mas standardize din ang kanilang services. And with this, no, even our ambulances, no, the Department of Health for several occasions now, we have already turned over several ambulances. And these are all means to strengthen the primary care network. And because of this, lalapit sa kanila na ang service, and because of the continuing trainings, no, assistance, no, better equipment, more skills, no, to our na malapit sa ating mga communities.
So, sa papaanong paraan mababago yun ng universal healthcare ang buhay ng bawat Pilipino?
Okay. May component dito, no, in the universal healthcare, all our citizens will be registered to a primary care facility, no? So mayroon na tayo itong example in the past, yung ginagawa dati yung PhilHealth natin noon, na meron tayong PhilHealth were assigning their indigent program members to health facilities noon. It would be similar to that, no? But in a broader sense, no? That everyone now will be registered to a primary care facilities, at dun ka that facility will take care of your health needs, no, pagkonsulta, and even referral to higher centers. So, yun talaga yung isang aspect dito, kasi yung service mo is not just the first meeting with the doctor, and in the primary care network included din yung referral to higher centers should the patient need referral to higher centers.
Are more services, higher services. So, Doc, matanong ko lang, lahat po ba ng pasyente or lahat po ba tayo kailangang dumaan sa primary care facility?
Okay, the idea is to go first to the primary care facilities, no? Because sila ang titingin kung ito ba kailangan sa internist o sa internal medicine, or ito ba kailangan i-refer ko sa surgeon. Kung babae ito, pwede ba ito ma-manage as a case lang ng medical case lang, or i-refer ko ba ito sa obstetrician or gynecologist? Kung bata ba, pwede pa ba ito outpatient? Kung mga simple pneumonia or something lang, mild pneumonia I mean, or is this admissible not for referral, no? But in cases where obviously emergency yung hindi naman din bawal, pwedeng dumiretso pa din sa hospital as the need arises, di ba? Pero kung outpatient lang naman, mas maganda sana dadaan ka muna dito, because yun nga, na-mention natin kanina, Jalil, one of the purposes of this is to decongest the hospitals, no? Kung pwede naman ito at hindi naman siya emergency, hindi naman siya life-threatening, pwede doon muna tayo sa primary care service. But if it's really an emergency and it's a matter between life and death, hindi naman kailangan na wala namang ganun. If you really need hospital services, you can immediately go to the hospital.
So parang yung primary care facility, yung ating first stop kung saan siya i-assess, at sila na yung magna-navigate kung based on the assessment, ano yung need. Tapos saka sila, yung primary care facility na yung magna-navigate as to where sila dapat pumunta for higher medical care.
And hindi lang yan, no? Even aftercare, no, from the hospital, no, yung parang step-down facilities din. They can also be the means of continuing medical services, kasi meron tayong mga diseases na lifetime na talaga, no, like yung lifetime diseases na hindi naman like let me mention, no, yung like hypertension, like diabetes, no, that there are acute phases of this, no, that urgencies that would need hospitalization. But even after hospitalization, you still need the care of an outpatient facility. Not necessarily a doctor, but our facilities have nurses and midwives who are also trained on these diseases, no, through the DOH program. And they can now help you, give you advice, monitor you, and with the DOH providing the medical assistance for like lifestyle diseases like diabetes and hypertension, they can avail of the available medicines that are even provided by our office in the different LGUs.
Napakaganda po ng sinabi niyo po niyang Doc, kasi yung majority siguro ng ating publiko, hindi nila alam na they can still avail healthcare services even after ng hospitalization nila, and makukuha nila yun sa kanilang mga rural health units or sa primary care facilities nila.
Yes, because Jeline, in the primary care units, no, like referring to the RHUs and the municipal health offices and the district health centers, they have registry for this, di ba? Meron silang club like diabetic club, meron silang hypertensive club, and they have listing registry, which is actually the basis of our allocations of medicines to this to the local government, and it is for their benefit. So through this, may in-encourage din natin yung ating mga citizens to go and register yourself kung ano, para if you have these conditions, para maka-avail kayo ng binibigay program, ang ating program medicines naman to the different health centers through their LGUs.
Okay, oo. So, Doc, punta naman tayo. Let's focus on the primary care facilities. Ano-ano po ba yung mga uri ng primary care facilities? What are we talking about po when we say primary care facility?
Okay, so I have been starting mentioning this, no, kanina. So the primary care facilities, no, are of course composed of our rural health units, the city health centers, the private medical clinics, the birthing homes, in urban centers merong OFW clinics, no. We have here in EVMC the OFW clinic at marami pang iba, no. In the primary care facility, if you are now licensed as a primary care facilities, it is already part of the requirement that your primary care facility, if you are already licensed, no, you already have your laboratory. It could be your own or with a memorandum of agreement, no, a MOA. You have your birthing home, you have an ambulance, you have your dental service, you have your X-ray, you have your and laboratory. So, yun yung ating doon, no? Composition ng ating primary care facilities. So that isang punta lang, our citizens can have access to a complete primary care service, no?
Okay, so sa ngayon, Doc, ngayong ongoing yung ating implementation ng Universal Healthcare sa region, ano ang tungkulin ng ARLED when it comes to the establishment po ng primary care facilities?
Okay, so ito ang aming tinitingnan ngayon ng ARLED, no? Ang function ng ARLED is to assess, no? To the use of an assessment tool, na binibigay din naman ito natin sa mga local government units and their health facilities, no, so that they can assess and they can comply kung anong mga kulang, and they have been given orientations, and we are open to them coming to our office if they need further technical advice, no, and these are because the required items there, no, ay kailangan minsan discuss pa sa kanila, and so with that we have 7 big divisions, no, na tinitingnan, no, or items na tinitingnan. First is personnel, no. Sinisigurado natin na they have the qualified personnel, na yung primary care workers na are delivering the services doon, no. By qualified women, they do have their PRCs, no, yung ating doctors, yung ating nurses, ating midwives, no, and that they are gainfully or they are just employed, no, whether hindi naman natin inaano kung regular or contractual, as long as they can present an employment evidence, no, that they are working for that facility, no. So yun yung pinakauna.
Doc, excuse. So when we say sa personnel, mayroon talaga tayong number kailangan may specific number na adequate number of personnel for this particular na facility?
Meron tayong hinihingi na minimum requirement. Hindi naman ito ibig sabihin na kailangan ng 3 or 4 na doktor. For a health facility, kailangan talagang may doktor. No? Like for example, for our rural health units, for our municipal health office, for every district health center, kailangan may isang doktor din. Kailangan may nurse doon. Kailangan may midwife doon. So, dito pa lang yan sa personnel. Of course, yung sinasabi nating ancillary services like yung ating clinical laboratory, then they should have they should have medtechs there. And there should also be a dentist because kailangan natin ng dental service, no? So, yung mga ganon. But of course, itong na-mention kong ancillary service, pwede naman din ito through a MOA, through a Memorandum of Agreement, as long as meron siya. So, titingnan natin. No? And syempre, kasali doon yung personnel. So, and number 2 natin na tinitingnan is their physical facilities. Now, we mentioned na kanina that they are required to submit a permit to construct because in the permit to construct, there is a floor plan. Natitingnan natin na there is an area for the different services na kailangan gawin except yung mga i-contract out nila, no? Which they are also allowed as long as they have a valid contract with these ancillary services. And ancillary service should also be a DOH licensed facility. Pangatlo is their equipment and instruments. Titingnan din natin, syempre, kung meron kang birthing home, titingnan natin kung may delivery table ka, meron kang primary and multiset, no? And that other equipment pa needed, no? Same. Titingin tayo ng dental equipment because kung meron kang dentist, dapat may dental equipment ka, may dental chair ka, clinical lab, so you have to have the laboratory equipment there. Number 4 is our service delivery. Ito ay tinitingnan natin through requiring them to present to us mga training certificates, no? For the different services na binibigay natin. For example, training on yung ating expanded program of immunization or yung ating animal bite treatment centers or yung ating national tuberculosis program. So, yun ang tinitingnan natin. And with that, kasama din ang policies nila. Titingin tayo kung meron silang policies na ginawa to guide them in the conduct of these programs, no? Okay, number 5 is quality improvement activities. What is this? This is a document that consolidates their plans for improvement and their measures, paano measure natin yung satisfactory service na binibigay. So, this could be in the form of yung ating mga rating records, yung ating mga IPCR, OPCR, yung mga ganun for individuals, no? And other things that ginagawa din nila, no, sa LGUs to monitor the satisfaction level of their customers. And then there's also the information management, which is actually tinitingnan natin we have mandatory requirements sa mga health centers to the RHUs and the city health offices, for example, yung reporting of notifiable diseases. So these are required. Titingnan natin na nandoon yun. And also, we would also see if they are implementing the Data Privacy Act, no? Because these are also laws na kailangan natin sundin in our health facilities. And I think the 7th na yata ito, no? The environmental management. And the environmental management would be, we would be looking at their waste management, solid, infectious, yung mga liquid. So, how are they managing this to keep it safe and kumbaga before they are hindi na sila infectious before they are disposed. So we're looking at documenting kanilang waste management policies and procedures, and also kung meron silang contract with private collection, yung mga waste collectors, or kung LGU naman ito, that they are really scheduled by the LGU's solid waste disposal, yung mga garbage collection, yung mga ganon-ganon. So tinitingnan natin yan.
So kasama pala yung environment sa
Oo,
inyong
oo, oo.
assessment.
Kasi kasali siya as a standard doon sa mga health facilities. And this does not stop sa kanila. Yung na-mention natin na kanila, infirmaries, hospitals, no, yung mga rehabilitation centers, tinitingnan din natin.
So lahat po yung mga pamantayan na yun applies to all facilities
Yes, more or less. More or less.
Okay. Alright. So ano naman po yung mga licensing requirements na dapat nilang i-comply para makapag-operate as a primary care facility?
We are happy to note, no, yung first requirement kasi nito is the DOH permit to construct, which is yung sinasabi natin that they will submit to us first the board resolution if this is an LGU-owned facilities establishing the primary care facility, no, and providing funds thereof for the operations. Okay, and then we also included dito is the floor plan, the very important floor plan. And so when the floor plan is determined to be by our engineers, determined to be in accordance to the prescribed floor plan by the Department of Health, then they are issued the permit to construct. After that, then they can already apply for a license, no? In the license, they are now given the assessment tool so that they can assess their facility as to their readiness to be inspected. When they can say that we are ready, we will pass already the standard, then they can apply it to our office with an application form also. Okay, so ganun na yun. So depende na sa kanilang nadadatnan ng ating inspection team doon sa kanila, and we're always hoping na they are already off standard, no? Okay.
So hanggang ilang taon po valid ang isang license to operate ng isang primary care facility?
Okay. So the license of the primary care facility is good for 3 years. However, the ancillary services, yung laboratory, yung clinical lab, pareho yun, no, yung birthing home, sila ay to renew their license yearly. So, kailangan, para masustain niya yung 3 years niya, dapat yung kanyang mga ancillary should also be renewed, no, yearly. Oo. Okay?
So, Doc, matanong ko lang, kailan sila pwede mag-enroll or magpa-certificate, or how do you call that, license?
We are already, even today, pwede na. Oo. And as I said kanina, we are happy to note that even last year, marami nang start na sa amin magpa-approve ng kanilang permit to construct. Siyempre, after the permit to construct, itong medyo matagal-tagal kasi they will construct the building. And of course, may tulong din ang Department of Health dyan to our health facility enhancement program. So, and I think some of them have already started with their construction. So, after that, mag-apply na sila ng kanilang license, hopefully.
Okay, so Doc, sa ngayon po, ilan po yung ating mga licensed na primary care facilities dito sa buong Eastern Visayas?
Okay, so I am happy to inform everyone. Meron naman tayong, because yung sinabi namin last year, marami talaga kaming PTCs na na-approve. At sabi natin, they're in different stages of construction at present, no? But we're happy to inform na meron naman din tayong nakapasa na sa licensing, no? Because sa amin ding enthusiasm to help them, so technical assistance din, no? Because our lead, that's what we're looking for is that we meet the standard, and the technical assistance we really can give is to advise paano ito natin mako-comply. Oo. So, number 1, we only have 5 licensed primary care facilities, and we're happy and we congratulate this for the pioneer, no? Number 1 is our rural health unit Can-Avid in Eastern Samar. Okay, so siya ay number 1. Hindi naman siya yung one as in number 1, pero dito lang sa aking arrangement, no? Pero yung Can-Avid talaga has been a license na by DOH even last year pa. Oo.
Isa siya sa mga naunang
Yes. Isa
ma-license.
siya. Pioneer talaga ang CAT-AVID. Congratulations to LGU CAT-AVID, no? Pangalawa is our Tolosa Rural Health Unit. So, pangatlo, matagal din ito na, siguro magkasabay lang ito ng CAT-AVID, no? Is our Borongan City Health Office. Borongan City Health Office. And then, just recently, malapit sa amin dito, we would like to congratulate also kasi newly lang sila na-license our Palo One-Stop Shop, no? Yung ating neighbor lang namin dito. So, lately lang din ito sila. And the other one is, bago din lang ito, just this year lang, is our RHU So Good and Birthing Facility, no? RHU So Good and Birthing Facilities. So, ito silang lima have been licensed this year, no? And ang sabi natin kanina, this is for 3 years, and they will just be monitored, no? And reminded to update their ancillary services na kailangang i-license every year. So again, to this 5, RHU CAT-AVID, Tolosa RHU, Borongan City Health Office 1, Palo One-Stop Health Shop, and RHU So Good Birthing Facility. Congratulations po, and do sustain your standards na na-achieve na, and do continue improving. We know you can do that, and your heart is there para dyan for the services sa inyong mga constituents.
Alright, so good news, may 5 PCFs na pala tayo dito sa Eastern Visayas, and I'm pretty sure in the next few months, mayroon pa tayong madadagdagan pa ang number na yan, Doc, no? So, siguro ano na lang po yung mensahe natin, Doc, sa ating mga manonood, especially yung ating mga managers ng ating mga health facilities, ating primary care facilities, and of course, sa ating publiko.
Okay, so from the Regulations Licensing Enforcement Division, no, and the Department of Health CHD 8, no, we would like to encourage you to continue your pursuit to have your primary care facilities, no, your RHUs, your municipal health offices, your city health office or district health offices to be go through the process of having it licensed, no? Pag-start tayo dun sa PTC, and we are thankful and we congratulate those who have already received their PTCs, meaning you have already complied with the initial floor plans, no, of the structures. And with those, we are happy to be of assistance to you. Whatever we can share, give to you that can help you establish your primary health care, no? As far as Ireland is concerned, we are happy to do that. And other sections and services and units dito sa Department of Health are also pitching in heavily doon sa desire to make your facilities primary care, no? Ang amin lang kasi is the balance between, while we want your facilities to be licensed, we also want that the license means something. It means that the services that we give are of good quality and are safe, and this is based on a minimum standard of for licensing, no? Yun lang ang atin, is to ensure that you have quality services and safe for our clients, and more importantly for our staff din. That is why kailangan ito, no? We have our HMEP for the equipment and facilities. We have our programs in the local health support division. They're doing consistently their trainings and assessment with you. We have our health facility development unit assisting you also for the policies and continually having dialogue with you on how the Department of Health, EV, CHD can help you. And so, surely with this, and let us not forget to pray for guidance, no? So, Kaya apart from Him, we can really do nothing. Di ba? So, just push, pursue, and keep the energy up and interest. So, until the time na ma-license tayo. So, keep it up everyone, and we just wish for a successful year. Initial implementation ng UHC. Okay.
All right. So with that, we thank you, Doc Noel Arteche, for sparing us your 1 hour. Marami po tayong natutunan, especially hindi lang ako sigurado, pati yung ating mga manonood at nakikinig. Kasi napakaganda po ng role ng binibigay ng RLAD po ng DOH sa ating mga health facilities. We are guiding, we are regulating to ensure na maganda ang kalidad ng serbisyo na binibigay sa ating publiko. So for our public, for our residents ng mga taga-Eastern Visayas, malaking assurance yung binibigay ng ating panauhin this morning si Doc Noel, na yung mga serbisyong nakukuha po ninyo sa ating mga rural health units and even sa ating mga primary care facilities na mga private din na nag-undergo ng mga license to operate are insured po na maganda yung quality. So I hope you avail these services. We have health services po na available and accessible at your doorstep. So within your locality lang, marami yung mga health facilities, health services na pwede nyo pong ma-avail or makuha. So, marami pa po yung ating i-discover ng mga divisions or yung mga units dito sa DOH EDCHD upang mas mapalawak natin yung mga nalalaman natin, yung kaalaman natin when it comes to the health services or programs na available at the same time appropriate sa ating needs. So, with that, tumutok pa rin kayo sa ating programa every Thursdays, 9 to 10 a.m. Muli, maraming salamat, Doc Noel Arteche, at of course, sa aming Regional Director Isofia Bisa Balderino. Sa susunod na linggo, magkita-kita tayo muli dito pa rin sa ating programa upang sama-sama nating malaman ang mga impormasyong pangkalusugan at magtulungang maisulong ang universal healthcare dito sa Eastern Visayas. Dahil ang inyong kalusugan ang aming priority number 1. Tara, dayon kita ha DOH!
Ang bilis talaga ng panahon, isang taon na naman ang lumipas. Ito na ang paborito nating okasyong ipinaghahandaan ng lahat. Si tatay at si nanay, lolo at lola, tito, tita at mga pinsan, mga kapitbahay at mga kaibigan, magtitipon-tipon na naman. Meron akong isang pakiusap, pakinggan niyo sana at pagbigyan. Sundin ang 7 healthy habits para healthy Pilipinas. Sama-sama tayo ngayong Pasko, lahat ay ligtas at masaya. Gusto ko sama-sama tayo, masaya magsalo-salo this Christmas. Healthy Pilipinas, ligtas tayo, oh 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 oh. Ligtas tayo this Christmas. Ligtas tayo, oh 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 oh. Isang healthy Pilipinas. Holiday season na naman, ang saya. Ang lahat excited na magkita-kita. Ang saya ng mga bata sa tuwing may regalo, lalo na kapag kumpleto tayo sa salo-salo. Ang Noche Buena dapat healthy na handaan iyan. Sari-sari mga prutas at gulay ay dagdagan. Ang pagpapaputok kada bagong taon, baka naman pwedeng balitan na ngayon. Masakit na sa bulsa, may pinsala pang dala, magpasabog na